Over the past few years, there has been an increase in ADHD adult diagnoses, especially in women. Today, the rise of social media has permitted to raise awareness about ADHD. Increasing awareness about ADHD by the patients and medical experts online has been a game changer, especially for minorities and women who have always been misdiagnosed due to masking symptoms in their childhood. In the UK, about 4% of adults have ADHD as of 2023, according to the National Institute for Health and Care Excellence. Based on ADHD UK, there are 2.6 million people in the UK who have ADHD, with women accounting for 1 in every ADHD diagnosis. So, what is ADHD, and how does ADHD affect women in everyday life? How do you explain the ADHD gender bias women suffer from in terms of symptoms and diagnosis? I first met with Narma, a 24-year-old woman with ADHD living in a hotel with her baby.
I'm currently homeless, living in a hotel with my 1-year-old, and I suffer from ADHD. I got diagnosed with anxiety during COVID, and then with depression. Despite me receiving therapy for them, it was as if the therapy wasn't working, and they did look like byproducts of something else. Fast forward to when I was pregnant, and all my symptoms just accelerated from there. And that's when I was on Instagram, I saw a doctor explaining all the symptoms of ADHD. And after that, I contacted my GP and I said, looking at my medical history, is it possible that I actually have ADHD? And the doctor told me, yes, it very much seems like you do have ADHD. As people with ADHD tend to get misdiagnosed with anxiety and depression more often, despite there being other symptoms. And that's when they decided to start the diagnosis process. It took me 5 months to get diagnosed. And after diagnosis, I was offered either medication or therapy. Because of my son having cow's milk protein allergy, we wasn't able to do that. Therefore, for a year, he had to be on breast milk. And recently, the homelessness has affected him pretty negatively as he stopped eating his solids and heavily relying on breast milk. And since he's not having his solids, it's stressing me out and giving me a lot of anxiety. Therefore, my milk production has decreased, which has put us in the cycle of where he's not eating and losing weight, and that's making me stressed. So therefore, I'm not eating and stressing, and that means my milk production is getting less, and he can't have much milk off me then because I've stressed and my milk's gone less. And then we're back in the cycle of I'm stressing and he's not eating. ADHD affects all parts of my life, and it also affects relationships, work. It affects myself, caring for somebody else, affects timekeeping. It affects every little detail in my life. Time blindness means that we perceive time differently to everybody else, even though that the minutes on the clock are going the same. But in our heads, time is different to us. Sometimes it'll speed up, sometimes it'll slow down based on our interests and how much pressure is put on us. So, for example, if we are meant to have an appointment at 2 o'clock, we will tend to be late. That is because the time before we travel, it slows down, so we perceive it that we have plenty of time, which is like a false perception. So we end up getting ready later, and even though we're rushing, we are actually physically moving slower. That's something that our brain does, and then at the end of the day, we leave out the door pretty late. Since becoming homeless, it has just made my ADHD much worse. I study fashion design at UAL London College of Fashion, and I had applied back in 2021, and I got into university before I was pregnant. Afterwards, my application was done. I found out I was pregnant, so I decided to take a gap year, and during that gap year, I was looking for properties to move for the following year into London. When I was looking, there seemed to be plenty of properties in my budget, so I was pretty happy with that. And as the time drew closer, about a month before moving out, I came for a short period of time, about 10 days, to look for properties and go to viewings. There had been a massive jump in rent prices up to about £400, and it had gone out of my budget. I couldn't move back into my previous flat as I had my loan, my university, and my future job set up here in London, but I didn't have a property, and the rents had gone above what I could afford. I fell into this gap of being homeless. Therefore, then the council took me on for emergency accommodation. So currently, I have been 3 months in a hotel room with my back then was a 9-month-old. Now he is 1 year old. The reason why I got diagnosed faster is because ADHD in women tend to appear when they are around 19. From 18 to 24 years old, that's when the symptoms really accelerate and show up. And that's why I got my diagnosis as I was within that age range and I was showing all those symptoms at the correct time. Whilst for boys and men, it tends to show at a very much younger age, and their symptoms are pretty different, as all the studies were done on men at the beginning of time. So they mainly look for symptoms in boys in primary schools, and this is why they missed a lot of the females. And now that slowly research is coming, they are seeing now what the symptoms are for women. One of the main different symptoms is that we mask things for a very long time until it physically exhausts us. So this is why then I do have the chronic fatigue syndrome, as not only mentally has it then exhausted me, it's also physically exhausted me. So if I'm in a very stressful environment, I'm not just mentally exhausted, then I am physically exhausted too. And this just keeps on going in a cycle of if something stresses me out, I tend to fall asleep pretty faster or go into this really strong desire to sleep, as my brain is no longer able to handle it, as it cannot mask any longer.
Dr. Jessica Iklas is a senior clinical academic psychiatrist at Brighton and Sussex Medical School and a specialist in neurodiversity.
My name is Dr. Jessica Eccles, and I am a clinical academic psychiatrist. So I'm really fortunate to have two roles. One is I work in the NHS 2 days a week in an adult neurodevelopmental service, so seeing patients, autistic patients, ADHD. And then 3 days a week I work at Brighton and Sussex Medical School, where I do research into brain-body interactions, particularly as they relate to a variant in how the body is built that can be manifest as joint hypermobility, flexible joints. We decided within our neurodevelopmental service to create the Neurodivergent Brain Body Clinic. So this is a clinic for neurodivergent people in Sussex to have assessments for and to explore their physical health problems. And we know that neurodivergent people struggle for years to get appropriate diagnoses and management plans for their mental and physical health symptoms, and that they often feel dismissed or overlooked, or they fall through the cracks in the medical systems. So we try and draw things together holistically so we can help support patients get the support that they need to manage their health problems. So in classical terms, ADHD is a constellation of features that span inattention, hyperactivity, and impulsivity. So that would be difficulty paying close attention to schoolwork or tasks as an adult. It isn't really so much inattention as difficulty switching between attention. So an ADHD person can become incredibly focused on a particular thing, sort of fall down a rabbit hole, and to the point where they might forget to eat or pee or go to sleep. But the difficulty is switching attention, is transitions, and focusing on boring and mundane tasks.
I then met with Dr. Sadiq Quram, a neurodevelopmental psychiatrist with ADHD, working in Oxford's NHS Orpington Foundation Trust, based in South East London, to better understand the process of getting diagnosed with ADHD in the UK.
I'm Dr. Khurram Sadiq. I am a consultant neurodevelopmental psychiatrist. I am leading an adult ADHD service in southeast of London. I've got fellowship from the Royal College of Psychiatry, and I'm currently working towards my master's degrees in neurodevelopmental neurosciences from King's College London. ADHD has existed all its life. Now, the reason between the disparity is a lot of females, they have got predominantly inattentive type of ADHD. And again, the research, as I said, was done on males. They're not taken into account the females. And again, the research has stagnated over a period of time. Like, they have not been challenging the diagnostics. For example, the hyperactivity doesn't have to be physical hyperactivity. It can be a mental hyperactivity where thoughts are going on and thoughts are racing and too many things. So that can be one element. The inattentive type can be masked very easily by females, by girls. And as I said, they are very good at masking. They are very good at mirroring. So the process of assessment is simple, but at the same time complicated, because there are services now, but there are massive waiting lists. So if you're looking at an NHS service, then it has to be referred by the GP. The GP do make the referral. It comes to a triage services in most places. It can be a single point of entry, or it can be a specific triage for that very specialist service, for ADHD service, and they screen the patients. And again, the screening is the clinical screening, where they go through the content and whether the referral is appropriate. If it is appropriate, they tell the person that they're going to be on a waiting list, but at the same time, again, in certain services, they provide some material whilst they're waiting for the ADHD assessment so that they can go through it beforehand. In certain services, they do a priority-based diagnosis, and in some services, they only see patients who are ADHD in crisis.